Hi everyone, this is Dr. Mungli. So today I am going to explain you one of the Kaplan questions from Kaplan Medicals related to biochemistry. Here is a case stem. So a 28-year-old man comes to the physician for a follow-up examination. He has a history of progressive end-stage hereditary emphysema. Several first-degree relatives have emphysema and also have hepatic disease. Several serum alpha-1 antitrypsin enzyme levels are low here. Increased activity of which of the following serine proteases best accounts for lung tissue destruction in this patient? Basically, if you see the case stem here, so here is a 28-year-old man. So he's basically coming up for a follow-up examination. So he has had a history of progressive end-stage hereditary emphysema. So basically the first disease that you are getting here in the case stem, it is about hereditary emphysema. So this is the one that you really need to notice here. This is a case of hereditary emphysema. So there are various causes for emphysema. So but here we are talking about hereditary emphysema. So now, and also it has been written that several first degree relatives have emphysema and also they have hepatic disease. So basically here the respiratory system is involved and also the hepatic system is involved. So it's an emphysema along with hepatic disease. So this hepatic disease, it may be a cirrhosis of the liver or any other liver condition. So now, and also the labs will say serum alpha-1 antitrypsin enzyme levels are low. So this is one of the significant point that we really need to note, that in the case stem alpha-1 antitrypsin levels are low, basically indicating there is an alpha-1 antitrypsin deficiency. Now because of this alpha-1 antitrypsin deficiency, so what is the enzyme, which of the serine proteases that are given below will be having decreased, means best accounts for lung destruction in this particular patient. So basically this is a case of alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency. This is a case of alpha-1 antitrypsin deficiency here. So in this case, so you are seeing emphysema and cirrhosis of the liver here. So emphysema here is a hereditary emphysema. Basically you see autosomal recessive inheritance pattern in alpha-1 antitrypsin deficiency. So that's why it is written as for several first degree relatives have been affected by this disease. And also this case stem has been made easy by giving the laboratory finding, that is serum alpha-1 antitrypsin enzyme levels are low. Now before we get into the options, we really need to know what is the function of alpha-1 antitrypsin here. So note that alpha-1 antitrypsin, it is synthesized from the hepatocytes or the liver cells, and the function of this alpha-1 antitrypsin is to take care of serine protease, particularly the elastase and also the trypsin. So elastase and the trypsin activities will be taken care by alpha-1 antitrypsin, and basically alpha-1 antitrypsin, it regulates the level or quantity of enzyme activity there. Okay, so whenever the alpha-1 antitrypsin deficiency occurs, so which of the serine proteases, they will increase their activity and thereby leading to lung destruction. So basically the answer is quite easy here. So obviously it goes for, if the alpha-1 antitrypsin is deficient, so whatever the enzymes that it is regulating, so those enzymes, they will have overactivity here. So usually it will go for elastase and the trypsin. So now since emphysema is seen here and also it is related with the hepatic disease, so it's a case of alpha-1 antitrypsin deficiency, and that's, so the alpha-1 antitrypsin, when it is not acting, so or when it is deficient in its activity, so elastase, it will be overactive and leading to lung destruction, because elastase, so here is the elastase, so option B, so which seems to be a correct answer here. So function of this elastase, So elastase is one of the serine protease. So before I get start explaining the individual functions of these enzymes present in the option, let me explain in brief about what is the meaning of serine proteases. So here is the serine proteases. So serine proteases are basically, so these are the enzymes which have got serine in their active site. This serine, it is acting as a nucleophile in the active site, thereby it helps in the breakage of peptide bond in a protein molecule. So whenever serine proteases word is used, so these are the enzymes which will use serine, which is an hydroxyl containing amino acid in its active site, and that hydroxyl containing amino acid serine is used as a nucleophile, and thereby it breaks down peptide bond of a substrate. Okay, that's the meaning of serine protease. So elastase, which is one of the serine protease, its function is to destroy elastic tissue, that is elastin. So elastin, which is in association with the collagen molecule, so elastin is the one which is responsible for elastic property of the connective tissue. So note that elastin is rich in lung tissue. So elastase, whenever it is released from neutrophils because of some inflammatory action and all the other related things, so when alpha-1-antitrypsin is down, so elastase will go unregulated and it will go on destroying the lung tissue. So that's the one which is responsible for lung tissue destruction in the hereditary leading to emphysema here. But why hepatic disease in alpha-1-antitrypsin deficiency? So the hepatic disease in alpha-1-antitrypsin deficiency is because the mutation in a gene coding for alpha-1-antitrypsin, so it will be synthesizing a mutated alpha-1-antitrypsin protein. And note that alpha-1-antitrypsin is a protein which is meant to be secreted out of the hepatocyte. So mutated protein, it will be retained within the endoplasmic reticulum. So because of the retention of alpha-1-antitrypsin within the endoplasmic reticulum, so endoplasmic reticulum will engorge, and that will lead to hepatic cirrhosis, basically cirrhosis of the liver and all the consequences. Now we'll move on to see the first choice, that is chymotrypsin. So the chymotrypsin, anyway, so chymotrypsin is not a correct choice for this particular case stem, but still chymotrypsin is one of the serine protease enzyme, and the function of this chymotrypsin is it is going to act on aromatic amino acids. It's going to act on the carboxyl side of aromatic amino acids. So there are three aromatic amino acids. We have tyrosine, then we have tryptophan, and then we have phenylalanine. Tyrosine, tryptophan and phenylalanine. These are the three amino acids, like carboxyl sides of these three amino acids will be attacked by chymotrypsin, thereby break open the peptide bond, and that's how the polypeptide chain is broken. So chymotrypsin, usually it is synthesized from pancreas as chymotrypsinogen, and inactive chymotrypsinogen, which is referred as zymogen, and chymotrypsinogen is activated into chymotrypsin by active trypsin molecule. Now this trypsin here, so option E, the function of trypsin is to act on basic amino acids, carboxyl side of basic amino acids, that is arginine and lysine. So carboxyl sides of arginine and lysine is clipped by the trypsin. So trypsin is, again, it is synthesized in its inactive form by pancreas, and that is trypsinogen. So trypsinogen is activated into trypsin by enterokinase or enteropeptidase enzyme, which will be located over the enterocytes. That's how trypsinogen is activated into trypsin, and now active trypsin, it will be activating chymotrypsinogen into chymotrypsin. Then we have two enzymes here. One is C, like in option C and D. So option C, it is plasmin. So plasmin, it is one of the enzyme, serine protease enzyme, which is present in the bloodstream. The function of this plasmin is to break down fibrin clot. So whenever the blood clotting process will go on, So fibrinogen, which is converted into fibrin, so fibrin forms a clot, and that blood clot lysis, that is fibrinolysis, will be done by plasmin enzyme. So that's something which is plasmin here. Now the thrombin. The thrombin is also a serine protease enzyme. So the function of this thrombin is to convert fibrinogen into fibrin. So basically thrombin is in its inactive form called prothrombin. So prothrombin, it's also present in the bloodstream. So whenever the clotting process has to go on in our body, prothrombin is converted to thrombin, and this thrombin is going to convert fibrinogen into fibrin, and fibrin forms a clot. So that's how the clotting process will go on. So whenever body doesn't need that clot, so plasmin is going to break down fibrin clot, and that leads to fibrinolysis. So in this sense, that thrombin and plasmin, they are having an opposite function, or the antagonizing function. So if you see all these choices and try to connect that with the case stem, so chymotrypsinogen is not a correct choice, then plasmin is not a correct choice because none of them will lead to emphysema and hepatic disease. Thrombin is not a correct choice, so which is not, it is something related with the coagulation process. So here it is hereditary emphysema and hepatic disease, so it's not a choice, correct choice. So trypsin is also not a correct choice, although it's a serine protease. It is going to be inhibited by alpha1-antitrypsin trypsin. So in alpha1-antitrypsin deficiency, some of the trypsin activity may go uninhibited, but it is not going to destroy the lung tissue. So that's why it may not lead to emphysema and hepatic disease. So in that sense, so elastase, which is going to act on elastic tissue, so and deficiency or uninhibited action of this elastase because of the deficiency of alpha1-antitrypsin, so can lead to emphysema and hepatic disease. So that's why option B, elastase, is correct choice. Thank you.